So while mania, while depression is about low mood and other symptoms that accompany that, mania is really the opposite. That whether we're talking about mania or hypomania, and we'll make that distinction in just a moment, we're talking about is elevation. And so mania is defined by elevated mood. Often that mood can be irritable, but elevated to the person, at least, the individual, is often a very good feeling. It's a feeling of euphoria and well-being. But at the same time, we see abnormally increased activity and energy. Lots of task-focused or goal-directed behavior, trying to get things done. Energy goes along also with the lack of need for sleep. So not sleeplessness the way we saw it with depression or disrupted sleep, but a lack of need for sleep, that there's sufficient energy even without sleep or without much sleep. And then there's other symptoms we'll talk about as well. The term hypo, the Latin term hypo, I think it's Latin, not Greek, means below or less than. And so hypomania is a state that is less severe than typical mania, but similarly about elevated mood and elevated activity and energy levels. So if we look at symptoms of mania, we need for a manic episode at least three of the following that are noticeably changed from baseline. And what we mean there is that this is a change for that individual from how they normally present. If mood is only irritable and not elevated and euphoric, then we need four. We can't count the irritable mood, even though we know it's common. We want to see more symptoms then. And so we talked about goal-directed activity before. We also see rapid speech, often pressured speech. The experience of being in the room with somebody with this kind of speech is often that you literally can't get words in, that they just talk seemingly without breathing. Obviously they're breathing, but there's not even room for breath. And so this kind of pressured behind it. And along with that, the speech often includes what we call flight of ideas, which is floating very quickly from idea to idea that have very little link. So, so somebody might say, I'm working on world peace. I really like peas. And I also like, I knew somebody once who was really good at appeasing people, right? So just making that link between different ideas that really are very unrelated. And they may describe on their own that their thoughts feel like they're racing in some way. We mentioned the decreased need for sleep earlier. At the same time, we have what is often called grandiosity or grandiose ideas, and that's about this very elevated self-esteem, believing that the individual believes they have special talents, powers, that they're accomplishing amazing thing. A friend of my son's was talking in a manic state almost nonstop about the fact that he was about to be a millionaire from a business that he was running. And he wasn't running a business, and he was not about to become a millionaire, but he wasn't lying. Like, it was really what he believed was about to happen. And the distractibility goes along with some other things we've already talked about, jumping from thing to thing. And one of the most difficult things about manic episodes is the likelihood that the person is going to use poor judgment, that their sense of euphoria, their sense of grandiosity is going to color their judgment in a way that makes it likely that they're going to engage in things that have, as it says here, painful consequences. So cheating on your spouse without really thinking through what the consequences of that might be. Unwise business investments, it says here the same friend of my son's had a family credit card because he was a young man and his parents had given him this while he was living away. And he bought a very, very expensive motorcycle with this credit card and drove it off the lot, right? It's not returnable once you've done that. And so that kind of reckless spending, I knew I didn't know him personally, of a judge many decades ago who had bipolar disorder, and during a manic episode he stood on a street corner and gave away his entire life savings in $20 bills. He just stood there for an entire day just handing money to anyone who passed him. right? So that kind of painful consequences. And just like depression, the symptoms have to be present most of the day, nearly every day. So this is not just a brief experience, but a more sustained experience. When we're talking about the difference between mania and hypomania, mania, we have symptoms for at least a week, or the symptoms are severe enough to require hospitalization, or they include psychosis, so delusions typically, delusions of grandeur, so not just elevated self-esteem, but things, but believing that you are Christ, for example, right? So ideas that go beyond just feeling very good about yourself to having things that are not based in reality in any way. And this is an important distinction here, because this young man I'm talking about, that I'm making reference to, he hadn't been manic for a week when he presented for the first time at the hospital, at the ER. He clearly was a danger or risk to himself. And whoever he saw at the hospital said he couldn't be diagnosed because he hadn't been having symptoms for at least a week. But he met the other two. He was a risk enough that hospitalization was necessary, and he also had delusions. And so it's important to know that you could have, if your symptoms are significant enough for 2 days, you can be diagnosed with a manic episode. And here we get the significant distress or functional impairment. If we go back to those 4 criteria for psychological disorder, we need to meet those in terms of the manic symptoms. Hypomania, on the other hand, we only need symptoms for 4 days. We see a clear change in function for the person, but they're not necessarily impaired in any way, and they cannot have psychotic symptoms, so no delusions. The minute there's delusions, we're talking about mania, not hypomania. And we'll talk a little bit more about hypomania when we're talking about the different forms of bipolar disorder in just a moment. But this is a good moment to say, people who have only hypomania, people who never experience full mania, actually find this state very, to almost be a positive thing, and in some ways very definitely a positive thing, that people who are hypomanic, right, so they have increased energy, they have increased sense of self-esteem, they have a decreased need for sleep, but it's not impairing them in any way. For many people, I think that might be a desirable state. And so one of the problems we have with people who have a history of becoming manic is, on the way to mania, you almost always pass through a hypomanic state, and it really can be very hard for people to give that up in terms of pursuing treatment. So that's just something to keep in mind. I moved my chair because the sun was behind me, and I wasn't sure how that was affecting the view. So when we talk about diagnostic categories with the bipolar disorders, we have 3 categories. So with depression, we had the 2, right, major depression and persistent depressive disorder. Here we have 3 diagnostic categories, and there's some very straightforward ways to distinguish them, and yet we will find that sometimes, even for clinicians, there's some confusion about what they are. So this is a good point in your education to just get very familiar with the distinctions. For bipolar 1, which is often what people think about with bipolar disorder, this is kind of a classic experience of mania that we just talked about. And bipolar, right, the bi piece of it means that you are going, that there are episodes of mania and episodes of depression. We can have the diagnosis. An individual can be diagnosed with bipolar 1 simply by the occurrence of a single manic episode. We don't need actually to see evidence of depression in order to diagnose bipolar 1. We assume that depression will come or has already come in the past, but the reality is even if there's evidence that we never see depression, although that is a likely scenario, a manic episode still gets an individual a diagnosis of bipolar 1. And again, this is an episodic disorder. The episodes, as we've talked about with depression, tend to recur. Similar to depression, that more than half of people with bipolar 1 will have 4 or more episodes of mania. But it's important also to know that in between, even without treatment, right, with treatment there's better prognosis, but even without treatment, that in between episodes of mania or episodes of depression, the person will have also periods, prolonged or short, depending on how their disorder goes. They'll have periods where they're neither manic nor depressed. And that's an important thing to know. It's not a constant experience. Bipolar 2, you must have major depression and at least one episode of hypomania. So bipolar 2 disorder does not include full manic episodes. Only bipolar 1 does. And so bipolar 2, you have major depression and then one episode of hypomania at least. Cyclothymia, which is this, still Latin term that they should have changed when they changed persistent depressive disorder, is kind of the equivalent of persistent depressive disorder. This is something that's going to last at least 2 years, just like PDD did. And those are milder symptoms of depression and also the presence of hypomania. So if you look at these, if somebody has a full manic episode, there's only one of these that they could possibly be diagnosed with. It's really only bipolar 1 that they can be diagnosed with if they've had a manic episode. And so we're going to stop there and pick up with epidemiology in the next video.